HTR2A. HTR2A stands for 5-hydroxytryptamine receptor 2A. 5-hydroxytryptamine receptor 2A is one of the receptors for serotonin. Mutations in this gene are associated with schizophrenia and obsessive-compulsive disorder, and are also associated with response to the antidepressant citalopram in patients with major depressive disorder, also known as MDD. MDD patients who also have a mutation in intron 2 of this gene show a significantly reduced response to citalopram, as this antidepressant downregulates expression of this gene. HTR2A also functions as a receptor for various drugs and psychoactive substances, including mescaline, psilocybin, 1-2,5-dimethoxy-4-iodophenyl 2-aminopropane, also known as DOI, and lysergic acid diethylamide, also known as LSD. It also affects neural activity, perception, cognition, and mood, and a role in regulation of behavior, including responses to anxiogenic situations and psychoactive substances. HTR2A is involved in intestinal smooth muscle contraction and may play a role in arterial vasoconstriction. The molecular functions for HTR2A are 1-4-iodo-2,5-dimethoxyphenyl propane 2-amine binding, serotonin binding, drug binding, and serotonin receptor activity. The biological processes for HTR2A are activation of phospholipase C activity, artery smooth muscle contraction, cell death, detection of mechanical stimulus involved in sensory perception of pain, memory, negative regulation of synaptic transmission, glutamatergic phospholipase C activating, serotonin receptor signaling pathway, positive regulation of ERK1 and ERK2 cascade, positive regulation of glycolytic process, positive regulation of peptidyl tyrosine phosphorylation, positive regulation of vasoconstriction, regulation of behavior, regulation of hormone secretion, response to drug, sleep, aging, behavioral response to cocaine, cellular calcium ion, homeostasis, detection of temperature, stimulus involved in sensory perception of pain, negative regulation of potassium ion transport, phosphatidyl and isotol 3-kinase signaling, positive regulation of cell proliferation, positive regulation of fat cell differentiation, positive regulation of MAP kinase activity, positive regulation of phosphatidyl inositol biosynthetic process, protein localization to cytoskeleton, regulation of dopamine secretion, release of sequestered calcium ion into cytosol, serotonin receptor signaling pathway, synaptic transmission, and urinary bladder smooth muscle contraction. Drugs used for the proper functioning of HTR2A are acepromazine, amisulpride, amitriptyline, amoxapine, apomorphine, aripiprazole, acenapine, bromocriptine, butriptyline, cabergoline, chlorprothoxine, citalopram, cisapride, clomipramine, clozapine, cyclobenzaprine, cyproheptadine, desipramine, donepezil, doxepin, penistine, ergoloid mesylate, ergotamine, flupentixol, fluspirilene, haloperidol, iloperidone, imipramine, ketamine, lyseride, loxapine, lorazepam, meprodoline, methotrimeprazine, methosergide, mianserin, minoprine, mirtazapine, molindone, nifazodone, nortriptyline, olanzapine, paliperidone, paroxetine, pergolide, pipotiazine, pramipexole, promazine, promethazine, propiomazine, quetiapine, rimoxapride, risperidone, ropinirole, sertindole, thioproperazine, thioridazine, thiofixine, trazodone, trimipramine, yohimbine, ziprasidone, and zuclopentixol. HTR2A interacts with the following genes: MPDZ, INADL, MPP3, PRDX6, DLG4, DLG1, CASK, APBA1, MAGI2, GRM2, and DRD2. Variants at the gene encoding for 5-hydroxytryptamine, also known as serotonin receptor 2A or HTR2A, have been associated with many psychiatric disorders, such as schizophrenia, mood disorders, attention deficit hyperactivity disorder, suicide, anxiety disorders, obsessive-compulsive disorder, eating disorders, and Alzheimer's disease. Diseases associated with this gene are cystic fibrosis, obstructive sleep apnea, cirrhosis, coronary artery spasm, Prinzmetal angina. If you have any concerns about this gene, contact a practitioner who is familiar with epigenetics and nutrigenomics.